I want to talk to you today about a group of medications that occupies a very particular place in the minds of the people who take them. Blood thinners, warfarin, and the newer tablets, Apixaban, rivaroxaban, edoxaban, dabigatran, which you may know by names like Eliquis or Xarelto. If you've been prescribed one, you were almost certainly told it's important, and you may also have been left with a quiet, persistent unease, a sense that you're now carrying something slightly dangerous around with you, that a fall or a cut could be serious, that you shouldn't take an aspirin, that you must be careful. And that unease is not entirely misplaced. These medications do demand respect and understanding. But here's what I want to do today in the calm and balanced way this channel always tries to. I want to replace vague anxiety with actual knowledge. Because a person who understands why they're taking a blood thinner, what genuinely matters day to day, and exactly which warning signs need attention, is a person who takes it safely for many years and gets the enormous benefit it was prescribed for, which for many of you is nothing less than the prevention of a devastating stroke. So today I'll explain what blood thinners actually do and, importantly, what they don't do, the two main reasons they're prescribed after 70, the crucial differences between warfarin and the newer tablets, the bleeding risks stated honestly and in proportion, the interactions and foods that genuinely matter, the practical rules about falls, dental work, and surgery, and, most importantly, the specific warning signs that mean call your doctor and the ones that mean call for emergency help. And I'll say at the outset what I say in every video, none of this is a reason to change a dose or skip a tablet on your own, and with these medications in particular, that matters more than almost anywhere else in medicine. Let me begin with what they actually do. Let me start by correcting the name, because blood thinner is a misleading term that causes real confusion. These medications do not thin your blood, they don't make it more watery or change its consistency at all. What they do is interfere with your blood's clotting system, making it take longer for a clot to form. Your blood contains a remarkable cascade of clotting factors, proteins that activate one another in sequence, like a line of dominoes ending in a solid clot, and anticoagulants, which is the proper name, block specific steps in that cascade. Warfarin works by reducing your liver's production of several clotting factors, which requires vitamin K, and that's why vitamin K matters with warfarin, a point I'll come back to. The newer medications called direct oral anticoagulants work more precisely, each blocking one specific clotting factor directly. Now here's the crucial concept, and it's the one that explains everything else about living with these tablets. This is a balance. On one side of the scales sits the dangerous clot you are preventing, and on the other sits the risk of bleeding. And your doctor prescribed this medication because, for you specifically, having weighed your risk factors, the benefit of preventing that clot substantially outweighed the bleeding risk. Everything you do while taking it, all the practical advice in this video, is about keeping that balance where it should be. And I should mention what these are not. They are not the same as aspirin or clopidogrel, which are antiplatelet medications working on a different part of the clotting system. And this distinction matters because taking both together, unless your doctor has specifically intended it, substantially increases bleeding risk. So an anticoagulant blocks the clotting cascade rather than thinning anything. It represents a deliberate balance between clot prevention and bleeding risk, and it is not the same thing as aspirin. Now let me tell you why you're probably on one. Let me give you the two main reasons these are prescribed after 70. The first, and by far the most common, is atrial fibrillation, the irregular heart rhythm I've discussed on this channel, where the upper chambers of the heart quiver instead of pumping properly, so blood pools and can form a clot, and if that clot travels to the brain, it causes a stroke. And I want to be very clear about the size of this benefit because it's the reason to take the tablet faithfufully. Atrial fibrillation multiplies stroke risk several times over, and anticoagulation reduces that stroke risk by roughly 2/3. And AF-related strokes tend to be among the most severe and disabling. So, for someone with atrial fibrillation, this tablet is one of the single most protective things in modern medicine, and every day it's taken is a day that risk is held down. The second main reason is treating or preventing venous clots, a deep vein thrombosis in the leg, or a pulmonary embolism in the lungs, where the medication stops an existing clot from growing and prevents new ones while the body dissolves it. And there are others, mechanical heart valves, which specifically require warfarin and certain other conditions, Why does knowing your reason matter? Because it tells you how negotiable the treatment is and because it frames the conversation with your doctor. So if you don't know precisely why you're taking yours, that is a good question for your next appointment. So most of you are taking this to prevent a stroke from atrial fibrillation, and the benefit is a roughly 2/3 reduction in that risk, which is why consistency matters so much. Now let me compare the medications because the differences are practical. Let me explain the differences between Warfarin and the newer tablets because they affect daily life quite differently. Warfarin has been used for decades, it's cheap, it's well understood, and it remains the required choice for people with mechanical heart valves and certain other conditions. Its defining features are that its effect varies with diet, other medications, and illness, so it requires regular blood tests, the INR test, which measures how long your blood takes to clot, with the dose adjusted to keep you in a target range. And this monitoring is genuinely important because too low means inadequate protection and too high means increased bleeding risk. It's also affected by vitamin K. And here's the point most people get wrong. You do not need to avoid green vegetables. In fact, avoiding them entirely is unhelpful. What matters is consistency, keeping your intake of vitamin K rich foods, the leafy greens, broccoli, sprouts, roughly the same from week to week so your dose stays matched to your diet. Large, sudden changes in either direction are the problem, not the vegetables themselves. The newer direct oral anticoagulants, Apixaban, Rivaroxaban, Edoxaban, Dabigatran, work more predictably, so they generally require no routine clotting blood tests. They have far fewer food interactions, and in the trials that brought them to market, they showed comparable or better stroke prevention with, importantly for older adults, lower rates of bleeding into the brain than warfarin. Their trade-offs are that they must be taken very consistently because they wear off faster, so a missed dose leaves you less protected sooner than with warfarin. Some are taken twice daily. They depend on kidney function, so the dose may need adjusting as kidneys change with age, which is why periodic blood tests are still needed even though clotting isn't monitored, and they're more expensive. So warfarin needs INR monitoring and dietary consistency. The newer tablets need fewer tests but stricter dosing discipline and kidney monitoring, and both are effective when taken properly. Now, the bleeding risk, stated honestly. Let me talk about bleeding honestly, in proportion. Yes, taking an anticoagulant means you will bleed more easily, and you'll notice this in ordinary ways. Cuts take longer to stop. You bruise more readily and more dramatically. You may get nosebleeds or bleeding gums when brushing, and these minor things are expected and manageable rather than alarming. What matters is knowing where the line is between expected and serious. Serious bleeding is uncommon but real, and it typically happens in three places: the gut, the brain, and internally after injury, and the risk rises with age, with kidney problems, with a history of previous bleeding or ulcers, with heavy alcohol use, with uncontrolled high blood pressure, and importantly, with combinations of medications. So it's worth knowing that the risk isn't a fixed number, it's something you and your doctor influence. Now let me give you the warning signs of serious bleeding, and I'd like you to learn these properly. Signs of gut bleeding: black, tarry, sticky stools or bright red blood in the stool, vomiting blood or material that looks like coffee grounds, and unexplained severe abdominal pain. And remember from my other videos that black tarry stools are always an urgent sign. Signs of bleeding in the brain, and these are the ones that must never be dismissed: a sudden severe headache, especially the worst headache of your life, confusion, drowsiness, weakness, or numbness on one side, vision changes, difficulty speaking, or a seizure. And I want to make one point with real emphasis here. If you take an anticoagulant and you hit your head, even in what seems like a minor fall, even if you feel fine afterward, you must seek medical assessment because bleeding inside the skull can develop slowly over hours or even days, and the early hours are when it's treatable. That single piece of advice is possibly the most important in this entire video. Other signs: blood in the urine, coughing up blood, heavy or prolonged nosebleeds that won't stop after 20 minutes of pressure, unusual widespread bruising and dizziness, breathlessness, or unusual pallor and fatigue, which can indicate slow internal blood loss and anemia. So minor bruising and slow-stopping cuts are expected. Black stools, vomited blood, sudden severe headache, one-sided weakness, and any head injury are urgent, and head injuries need assessment even when you feel fine. Let me cover the interactions and daily life rules that genuinely matter. First, the most important medication rule: be extremely careful with painkillers. The anti-inflammatory painkillers ibuprofen, naproxen, diclofenac are the big one because they irritate the stomach lining and affect platelets. And combined with an anticoagulant, they substantially raise the risk of serious gut bleeding. So, as a general rule, paracetamol is the safer everyday choice for aches and pains while on an anticoagulant. And anti-inflammatories should only be taken if your doctor specifically approves. Aspirin likewise, unless your doctor has deliberately prescribed both together for a specific reason. Second, tell everyone, every doctor, every dentist, every pharmacist, and carry a card or wear a medical alert stating which anticoagulant you take because in an emergency, that single piece of information changes how you're treated. Third, be cautious with supplements and herbal products because several affect clotting or interact, including fish oil in high doses, ginkgo, garlic supplements, ginger, turmeric in large amounts, vitamin E, and, importantly for warfarin, St. John's wort, which reduces its effect, and cranberry juice in large quantities, which may increase it. So please ask your pharmacist before starting anything, including things that feel harmless because they're natural. Fourth, alcohol in moderation because heavy drinking both increases bleeding risk and, for warfarin users, destabilizes the INR. Fifth, plan ahead for procedures, any surgery, and many dental procedures, including extractions, colonoscopies, injections, and even some eye procedures, need planning, and the rule is that your doctor or dentist decides whether and when to pause the medication because pausing unnecessarily exposes you to clot risk and not pausing when needed exposes you to bleeding. So tell them well in advance and follow their specific instructions. Sixth, practical daily protection. Use an electric razor rather than a blade, a soft toothbrush. Take care with sharp knives and garden tools. Wear gloves for rough work and make your home fall safe, which, as I always say, means clear floors, good lighting, secure rugs, grab rails where needed, and treating your balance and strength as medicine because for someone on an anticoagulant, preventing falls is directly preventing bleeding. So avoid anti-inflammatory painkillers. Tell every clinician and carry a card, check supplements, moderate alcohol, plan procedures in advance, and fall-proof your life. Let me say something about the tablets themselves because adherence is where the real-world benefit is won or lost. These medications only protect you while they're in your system, and with the newer ones in particular, missing doses leaves you unprotected within a day or so. Studies consistently show that a substantial proportion of people miss doses regularly, often because these tablets treat something invisible, so there's no immediate feedback either way. So the practical advice, use a weekly pill organizer, anchor the tablet to a fixed daily routine, set an alarm if it's a twice daily one, and know the rule for a missed dose, which differs by medication. So ask your pharmacist specifically, what do I do if I miss a dose of my particular tablet? And write the answer down. Because the general principle is take it if you remember reasonably soon, but never double up, and the specifics matter. And please never stop an anticoagulant on your own, not because bleeding worried you, not because you're going on holiday, not because you ran out and it seemed easier, because stopping abruptly leaves you exposed to exactly the stroke or clot the medication was preventing. And if you have concerns, or if the cost or the monitoring is a burden, those are all legitimate things to raise with your doctor, who has options, including switching between medications. So take it consistently, know your missed dose rule, never run out, and never stop without a conversation. Let me be very clear about when to seek help. Call emergency services immediately for a sudden severe headache, confusion, drowsiness, weakness or numbness on one side, difficulty speaking or vision loss, remembering fast, for vomiting blood or coffee ground material, for any significant head injury or fall where you hit your head even if you feel completely fine, for a major injury or a wound that won't stop bleeding, and for severe abdominal or back pain with dizziness or paleness. Contact your doctor urgently the same day for black tarry stools or blood in the stool, for blood in the urine, for coughing up blood, for a nosebleed that won't stop after 20 minutes of firm pressure, for unusual widespread bruising, and for new dizziness, breathlessness, or unusual fatigue and pallor, which can mean slow internal bleeding. Contact your doctor non-urgently before any procedure or dental work. Before starting any new medication or supplement, if you're missing doses regularly for any reason, and if you have concerns about the medication, so that the balance can be reviewed rather than abandoned. And for warfarin users specifically, contact your clinic if you're ill with vomiting or diarrhea, if you start any new medication, or if your diet changes significantly, because all of those affect your INR. So, head injuries and neurological symptoms are emergencies, visible bleeding is same day, and procedures and new medications are always a conversation in advance. Let me paint you a picture. Picture a man of 76 with atrial fibrillation taking Apixaban twice a day. He understands why. He keeps it in a weekly organizer by the kettle so it's anchored to his morning tea and his evening one. He's told his dentist and carries a card in his wallet. He uses paracetamol rather than ibuprofen for his knees after asking his pharmacist. And his hallway rug has been fixed to the floor and his stairs have a second rail because he understood that fall prevention is bleeding prevention. One afternoon, he trips in the garden and knocks his head on the doorframe, and he feels fine, genuinely fine, and every instinct says to make a cup of tea and forget about it, but he remembers the rule, and he goes to be checked, and the scan finds a small bleed developing that is caught and managed early rather than discovered 2 days later after he'd become confused. That is the entire video in one story, the tablet doing its enormous, invisible work of stroke prevention every single day, and the person carrying the handful of rules that keep it safe. And contrast that with the man who, worried by something he read, quietly stops taking his tablet for a month and tells nobody, and whose atrial fibrillation, unchanged and unmedicated, does exactly what it does. Neither the tablet nor the condition announces itself day to day, which is precisely why the knowledge matters. And let me speak briefly to those of you caring for an older parent or partner. Know which anticoagulant they take and make sure it's on every list, at every appointment, at every pharmacy, and that they carry a card. Help with adherence, since the pill organizer and the routine anchor are genuinely the difference between protection and gaps, and ask honestly whether doses are being missed, because people rarely volunteer that. Fall proof their home seriously, because for a person on an anticoagulant, a fall carries a different weight, and support the balance and strength work that prevents falls in the first place. Learn the emergency rules, and above all, learn this one. If they hit their head, they get assessed today no matter how well they seem, because that is the situation where a few hours genuinely matter. And watch for the quiet signs of slow bleeding, increasing tiredness, breathlessness, and pallor, which are easy to attribute to age and are worth mentioning to a doctor. So let me draw this all together calmly. Anticoagulants don't thin your blood, they interrupt the clotting cascade, and they represent a deliberate, carefully weighed balance. On one side, the stroke or clot they prevent, and for atrial fibrillation, that's a roughly 2/3 reduction in stroke risk, and on the other, the bleeding risk they carry. Warfarin asks for regular INR monitoring and consistent, not absent, vitamin K intake, while the newer tablets ask for stricter dosing discipline and periodic kidney checks. Expect minor bruising and slower stopping cuts, and know the serious signs precisely: black tarry stools or vomited blood, sudden severe headache, one-sided weakness or speech difficulty, and above all, know that any head injury needs assessment even when you feel perfectly well, because a bleed inside the skull can take hours or days to declare itself. Avoid anti-inflammatory painkillers, check every supplement, tell every clinician and carry a card, plan every procedure in advance, and treat fall prevention as bleeding prevention. So here's what I'll leave you with, straight and clear. First, know which anticoagulant you take and exactly why. And if you don't know the reason, ask at your next appointment. Second, take it with absolute consistency using an organizer and a routine anchor, and ask your pharmacist what to do if you miss a dose of your specific tablet. Third, protect yourself from the avoidable risks. No ibuprofen-type painkillers without approval, no new supplements without asking, moderate alcohol, and every dentist and doctor told in advance. Fourth, fall-proof your home and work on your balance and strength, because for you, a prevented fall is a prevented bleed. And fifth, memorize the one rule that matters most. If you hit your head, you get checked the same day, however fine you feel. These medications prevent enormous numbers of devastating strokes every year, quietly, invisibly, in people who never know which stroke they avoided, and the small handful of rules in this video is what lets them do that work safely for years. So take care of yourself, take it faithfully, tell everyone who treats you, keep your floors clear, and never sleep on a bumped head. And because doses, pauses for procedures, and every concern about these medications belong with your prescriber, please treat any wish to stop any new medication or supplement and any planned procedure as a conversation with your own physician. Treat visible bleeding as a same-day call, and treat head injuries and neurological symptoms as your reason to seek emergency care immediately.